plan, and I'm glad to say that the spare capacity in critical care in the NHS today has reached a new record high of 2,657 beds. Expanding the NHS faster than the growth in demand has been a critical objective throughout this crisis, and it means that every single person who's accessed NHS care has been able to get the very best available. At no point has the NHS been unable to offer care to people suffering from coronavirus. Now, I know at the start of this crisis, some people said that would be impossible. But so far, we've met this objective throughout. And I want to thank all those involved for their part in this national effort. On the most recent figures, 313,769 people have now been tested for coronavirus. Of these, 98,476 people have tested positive. The number of patients in hospital with symptoms is now 19,529. 12,868 people have sadly died, an increase of 761. This all just goes to show why we cannot let up in our efforts. We cannot let go of the hard work that's been done so far. This shared sacrifice, and I know it's a sacrifice, is starting to work. But we will not lift these measures until it is safe to do so. Everyone who stays at home is doing their bit, protecting the NHS and saving lives. Today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home. We'll test all symptomatic care home residents, and as I announced last Friday, we've introduced testing for all social care colleagues and members of their households who need a test. At the same time, we're increasing again PPE supplies to social care. We're creating a supply, logistics and distribution network of unprecedented scale. One of the things that I'm most proud of during this terrible crisis is that people have held health and social care workers in such high esteem across the board. It's not clap for the NHS, it's clap for our carers. And to take this further, we're today introducing a single brand for social care to symbolise the entire care profession. This is something I know so many people in the profession have called for. This badge will be a badge of honour in a very real sense, allowing social care staff proudly and publicly to identify themselves, just like NHS staff do with that famous blue and white logo. I know that many businesses will want to offer the same recognition and benefits as they do wonderfully to the NHS.